Soft indoor ambiance. Subtle discomfort. Slow movement. A slight pain can often be ignored. At first, it feels manageable. You adjust your posture. You tell yourself it's just temporary. But slowly, it begins to stay. Sitting becomes uncomfortable. Standing takes effort, and even simple movements start to feel difficult.
It started as a mild discomfort. I didn't think it was serious.
And now you can't even sit properly for long.
It hurts the most when I try to stand up after sitting.
That's when we realized we shouldn't ignore it anymore.
I thought it would go away on its own.
Most people think that, until it starts affecting their routine.
This morning was worse. My back felt really stiff.
That's when we decided to take it seriously and come here.
I just hope it's nothing serious.
Whatever it is, at least we'll understand it clearly today.
Back pain is one of the most common problems today. But what truly matters is not just the pain. It is how we understand it and respond to it. Because the right questions lead to the right diagnosis, and clear communication reduces confusion and fear.
Episode 22. C. Doctor-patient conversation. Back pain. Orthopedics. This episode is part of our playlists, Real-Life Conversations and Medical English Conversations.
Notice how the doctor interacts with the patient, asks focused questions, and understands the problem step by step, using simple and practical English. To help you practice regularly, we also post 2 MCQs daily in the community section.
At FluentEars, we follow a simple fluency method. Listen carefully, repeat confidently, note down the vocabulary and expressions from the subtitles. Use them in your daily life. Fluency is built through consistent practice, not memorization.
Soft clinic ambiance. A door opens gently. Emma and Rianne enter the orthopedic consultation room. Emma walks slowly, one hand placed on her lower back, careful with each step. Dr. Miller looks up from his desk. "Please come in." Emma and Rianne step inside.
"Have a seat."
Emma lowers herself into the chair cautiously, adjusting her posture as she sits. Rianne sits beside her, watching her closely. There is a brief pause.
"What seems to be the problem?"
I've been having pain in my lower back.
It started a few days ago, but it's getting worse.
At first, it was just a mild discomfort.
She thought it would go away on its own.
Yes, I didn't think it was something serious.
"When did you first notice it?"
Around 3 days ago.
It wasn't very noticeable in the beginning,
I could still sit and work normally,
but gradually it started bothering her more.
especially when I sat for long hours.
She spends most of her day sitting.
Yes, and I didn't pay much attention to it at that time.
"Are you able to sit comfortably now?"
Emma shifts slightly in her chair, trying to adjust her position.
Not really. Sitting for too long makes it worse.
She keeps changing her position every few minutes.
I feel like I can't stay in one position comfortably.
Even small adjustments don't help much.
It's like the pain just stays there.
A brief silence follows.
I thought rest would help, but it hasn't improved much.
In fact, it feels worse than before.
Yes, especially when I try to stand up after sitting.
That's when she feels the most discomfort.
It takes a moment to straighten my back properly.
And during that time, she feels a sharp pull.
I didn't expect it to affect my routine like this.
That's why we decided not to ignore it anymore,
I just want to understand what's causing it.
and what we should do next.
A brief pause settles in the room. Dr. Miller observes her posture carefully, the way she sits, the way she avoids sudden movement, and the subtle discomfort in her expression. The consultation has begun. The focus will now move toward understanding the cause behind the pain. The room remains calm. The focus now shifts toward understanding the cause of the pain.
Did anything trigger the pain?
I'm not completely sure, but I think it might be because of my routine.
She sits for long hours without taking proper breaks.
Yes, I usually work for hours without getting up.
Do you maintain proper posture while sitting?
Emma hesitates slightly.
Honestly, not always.
She often leans forward while working.
Yes, especially when I'm focused, I don't notice my posture.
That can put extra strain on your lower back.
I didn't realize it could have such an effect.
Most of us ignore posture until something like this happens.
That's true. I never paid attention to it before.
Did you lift anything heavy recently?
Emma thinks for a moment.
Yes, 2 days ago I lifted a box at home.
It was quite heavy.
I didn't think much of it at that time.
Did you feel any discomfort immediately after lifting it?
Maybe a little, but it wasn't very noticeable.
She didn't mention it seriously at that time.
I thought it was just temporary.
Did the pain start suddenly or gradually?
Gradually. It wasn't strong at first.
It slowly became more noticeable.
Yes, and now it feels much worse than before.
Does the pain increase with movement?
Yes, especially when I bend or try to stand up.
That's when she feels the most discomfort.
Even simple movements feel different now.
She's been avoiding bending completely.
I feel like if I move too much, it might get worse.
A brief pause follows.
I didn't think sitting and lifting could cause this much pain.
It's surprising how small things add up.
I kept ignoring the signs.
Most people do, until it starts affecting daily life.
Now, even basic movements feel uncomfortable.
That's why we thought it's better to understand the cause properly.
Yes, I don't want to make it worse by ignoring it again.
And we also want to know what changes we need to make.
Especially in my daily routine.
A short silence settles in. The cause is becoming clearer. Long sitting hours, poor posture, and sudden strain from lifting. The consultation now moves toward understanding how the pain is affecting movement and daily function. The conversation becomes more focused. The doctor now shifts attention to how the pain is affecting daily movement.
Where exactly do you feel the pain?
Mostly in my lower back, right in the center.
She keeps pointing to the same area.
Yes, that's where it hurts the most.
Does the pain spread to your legs?
Sometimes, not exactly pain, but a pulling sensation.
She mentioned that yesterday as well.
It's not constant, but it feels strange.
Are you able to bend properly?
Emma tries to lean forward slightly, then stops midway.
Not fully. It hurts when I try.
That's why she's avoiding bending completely.
Even small movements feel uncomfortable.
Does the pain increase after rest or in the morning?
Yes, especially in the morning.
She said her back feels stiff when she wakes up.
It takes time before I can move normally.
And during that time, she struggles to straighten her back.
A brief pause. Emma shifts slightly in her chair, her face tightening. Rianne notices immediately.
See? Even now she's uncomfortable.
Emma lets out a slow breath, her expression showing discomfort.
That look. You're in pain again, right?
Emma nods slightly. Dr. Miller observes carefully.
I can see a slight grimace on your face, meaning a facial expression that shows pain or discomfort.
Yes, I didn't even realize I was showing it.
It's been happening often.
I try to stay still, but the discomfort just comes back.
That's your body responding to the strain.
It feels frustrating, like I can't control it.
She's being very careful, but it still hurts.
Even simple things feel difficult now.
A short silence follows.
I feel like I don't know how to move properly anymore.
Rianne looks at her, then at the doctor.
She said something yesterday that really explains it.
Yes, I told him I feel like a fish out of water, like I'm uncomfortable even in normal situations.
Dr. Miller nods slightly. That's a very accurate way to describe it.
Even basic movements feel unfamiliar.
Like sitting, standing, even walking.
I keep thinking before every movement.
And that makes everything slower and more difficult.
I didn't expect it to affect me like this.
It's not just physical. It's affecting her confidence too.
Yes, I feel hesitant all the time.
A brief pause settles in the room. Dr. Miller listens calmly, allowing her to express everything without interruption.
I just want to move normally again.
And without thinking about the pain all the time.
That's all I want right now.
The impact of the pain is now clear, not just physically, but emotionally. The consultation now begins to move toward understanding her background and daily routine in more detail. The tone becomes slightly calmer. The focus shifts from immediate pain to understanding Emma's background and daily routine.
Have you had any similar issue before?
No, nothing like this.
This is the first time she's dealing with back pain.
I've had minor discomfort before, but it never lasted this long.
Any previous treatment for back or spine-related problems?
No, never.
She's generally been fine, health-wise.
Yes, I've never needed treatment for something like this.
Are you taking any medication right now?
No, nothing at all.
She didn't take any painkillers either.
I wasn't sure what to take, so I avoided it.
A brief pause.
What kind of work do you do?
I work at a desk, mostly sitting for long hours.
She spends almost the entire day in front of a screen.
Yes, sometimes I don't even realize how long I've been sitting.
Do you take regular breaks during work?
Not really. I usually continue working without stopping.
That's been her routine for a long time.
I always thought it was normal.
Do you exercise regularly?
Emma hesitates slightly.
Not consistently.
She starts sometimes, but doesn't continue.
I keep planning to be regular, but I don't follow through.
A short silence follows.
I feel like my routine might be the reason for this.
It seems connected.
Sitting for long hours, no exercise, it adds up.
And then lifting something heavy made it worse.
Yes, I didn't think all of it together could cause this.
Dr. Miller nods calmly.
It's important that we're on the same page, meaning we clearly understand what's contributing to the problem.
Emma looks at him attentively.
On the same page, so we both understand the cause clearly.
Exactly.
That helps, because now we know what needs to change.
Yes, it's not just about the pain, but also my routine.
That's right.
I guess I've been ignoring my body for a while.
Most people do, until something like this happens.
I don't want to repeat the same mistake again.
That's why understanding this properly is important.
Yes, I want to fix it from the root.
A brief pause settles in. The conversation has now provided a clear picture of her lifestyle, habits, and possible causes behind the pain. The consultation now moves forward toward a detailed physical examination. The atmosphere becomes more focused. The doctor prepares to examine the affected area more closely.
Please stand up.
Emma slowly gets up from the chair, placing one hand on her lower back for support. Rianne watches carefully, ready to assist if needed.
Take your time.
Emma stands upright, but her posture remains slightly stiff.
Try to bend forward slightly.
Emma attempts to bend, moving cautiously. She stops midway.
I can't go further. It hurts.
That's exactly what happens at home, too.
It feels tight when I try to bend.
All right, don't force it.
A brief pause.
Now, try to lean backward a little.
Emma tries to lean back slightly, then immediately returns to her original position.
That's uncomfortable too.
She avoids that movement completely.
It feels like something is pulling.
Okay, let me check your back.
Emma stands still as the doctor gently examines her lower back. He places light pressure along the spine and surrounding muscles. Emma reacts slightly.
Yes, that area is sensitive.
That's where she usually feels the pain.
Dr. Miller continues the examination, pressing different points carefully.
Tell me if the pain increases anywhere else.
It's mostly in the same place, but sharper when you press there.
It's very sensitive to touch.
Even light pressure feels uncomfortable.
The doctor observes her posture from different angles. He steps back slightly.
Try to straighten your posture.
Emma adjusts her position slowly.
I can't keep it straight for long.
She keeps shifting her position.
It feels like I need to move constantly.
Now, try to turn slightly to one side.
Emma attempts a small rotation.
That also hurts.
That's why she avoids turning.
I feel restricted, like I can't move freely.
Try to stand still for a moment.
Emma stands still, but her discomfort is visible. Dr. Miller observes her carefully, the stiffness, the guarded movements, and the way she avoids sudden motion.
Try to relax your back as much as possible.
Emma takes a slow breath, trying to ease the tension.
I'm trying, but it still feels tight.
She's been feeling this tightness since morning.
It doesn't go away completely.
A brief silence follows.
Is this a serious sign?
It doesn't look normal.
I've never felt this kind of restriction before.
Dr. Miller remains calm, continuing to observe.
It feels strange, like I can't trust my movements.
That's why she's been very careful all day.
Even small actions feel risky.
We didn't want to make it worse by doing something wrong.
That's why we thought it's better to get it checked properly.
Yes, at least now we're getting clarity.
I just want to know what exactly is happening.
And what we should do next.
Dr. Miller steps back slightly, having completed the examination. His observations are now clear. The pattern of pain, the restricted movement, and the response to pressure all point toward a muscular issue rather than something more severe. The consultation now moves toward diagnosis and explanation. The room becomes quieter. The examination is complete. Emma and Rianne sit back down, waiting for clarity. There is a brief pause before the doctor speaks.
It appears to be a muscle strain in your lower back.
A muscle strain?
So it's not something very serious.
I was worried it could be something more.
A short silence follows. Dr. Miller maintains a calm tone.
Based on your symptoms and the examination, it doesn't look like a major structural issue.
That's a relief.
So no fracture or serious damage?
No, nothing suggests that at this stage.
Emma exhales softly.
I was really worried about that.
We thought it might be something serious because of the pain.
Pain can sometimes feel intense, even in minor conditions.
Yes, it felt worse than I expected.
Especially when she couldn't move properly.
That's what scared me the most.
Dr. Miller nods slightly.
In a nutshell, meaning in a simple and clear way, your back muscles have been strained due to prolonged sitting, poor posture, and sudden physical effort.
Emma listens carefully.
So it's more about how I've been using my body?
Exactly.
That makes sense. Everything adds up.
Sitting for long hours, no breaks, and then lifting something heavy.
It all contributed.
Yes, it's a combination of factors.
I didn't realize small habits could lead to this.
Most of us don't think about it until something happens.
I guess I've been ignoring the warning signs.
A brief pause.
Will it take a long time to recover?
That's what I wanted to ask too.
I just want to get back to normal.
Dr. Miller speaks in a reassuring tone.
Don't worry, most muscle strains improve with proper care and rest.
That's good to hear.
So it's manageable.
Yes, as long as you follow the right approach.
I was afraid it might get worse.
Or become something permanent.
That's unlikely if you take care of it properly.
Emma relaxes slightly.
That's a relief.
At least now we know what we're dealing with.
Yes, knowing the cause makes it less scary.
And now we can focus on recovery.
I just want to make sure I do everything correctly this time.
We'll follow the instructions carefully.
Yes, no more ignoring.
A brief pause settles in. The fear that was present earlier has now reduced, replaced by clarity and understanding. The consultation now moves toward discussing the treatment plan and recovery steps. The atmosphere becomes lighter as the focus shifts toward recovery and next steps.
You need to avoid strain on your back for a few days.
So I should limit my movement?
Avoid sudden movements and heavy lifting.
That makes sense. Those seem to trigger the pain.
Yes, I'll be more careful now.
Rest is important, but complete inactivity is not recommended.
So I should still move a little?
Yes, gentle movement is helpful.
That sounds manageable.
You should also maintain proper posture while sitting and standing.
I think that's where I went wrong.
She usually sits for long hours without breaks.
I'll make sure to take breaks regularly now.
That will help reduce the strain on your back.
What about pain relief?
I'll prescribe mild medication if needed.
That should help her stay comfortable.
Yes, especially at night.
You can also apply a hot compress to relax the muscles.
How often should I do that?
2 to 3 times a day for short durations.
We'll make a routine for that.
That will help me stay consistent.
A brief pause. Dr. Miller continues in a calm tone.
Over time, these steps will help whittle down the pain, meaning reduce it gradually.
Emma listens carefully.
Whittle down. So it won't go away instantly?
No, it improves step by step.
That's important to understand.
I'll be patient with the process.
That's the right approach.
A short silence follows.
As your body recovers, you'll start to feel more relaxed and comfortable again. A more serene state.
Emma smiles slightly.
Serene, calm and comfortable.
That's what we're aiming for.
Yes, I just want to feel normal again.
And without constant discomfort.
I'll follow everything properly this time.
No shortcuts.
Definitely not.
Also, once the pain reduces, you can start light stretching exercises.
That will help prevent this from happening again?
Yes, along with maintaining good posture.
We'll make sure she stays consistent.
I don't want to go through this again.
And now we know what caused it.
That makes it easier to fix.
A brief pause settles in. The tension from the beginning has eased. There is clarity now, along with a practical path toward recovery.
Come back for a follow-up if the pain doesn't improve.
Okay.
We'll keep track of the progress.
Thank you, doctor. This really helped.
Yes, we understand everything much better now.
I feel more confident about handling it.
That's what we needed.
Thank you again.
Dr. Miller nods calmly. The consultation ends with reassurance, clarity, and a clear direction for recovery. Emma and Rianne step out of the clinic. The atmosphere feels calmer now.
I feel much better after talking to the doctor.
Yes. At least now everything is clear.
Earlier, I was just worried without understanding the problem.
And now we're on the same page.
Yes, we both understand what caused it.
That makes it easier to fix.
A brief pause.
I also liked how he explained everything.
Especially when he said it in a nutshell.
Yes, simple and clear.
Muscle strain due to posture and routine.
That made everything easier to understand.
A short silence follows.
I didn't realize I was making that face in pain.
You mean the grimace?
Yes, I didn't even notice it.
It clearly showed how uncomfortable you were.
I guess my body was reacting more than I thought.
And that's why it felt so intense.
I also remember what I said, feeling like a fish out of water.
Yes. Uncomfortable even in normal situations.
That perfectly described how I felt.
But now it feels more manageable.
Yes, especially knowing it will improve.
The doctor said it will whittle down gradually.
That's important, not expecting instant recovery.
Exactly.
And slowly, things will feel normal again.
A more serene state.
Emma smiles.
That's what I'm looking forward to.
And this time, we'll be careful.
Yes, better posture, regular breaks, and some exercise.
No more ignoring the signs.
Definitely not.
They walk forward with more clarity and confidence than before. A simple conversation can teach more than complex lessons. Today, you observed how a doctor and patient communicate clearly during a back pain consultation.
You saw how the right questions help in understanding the problem, and how simple explanations reduce confusion, fear, and uncertainty.
Episode 22C, Doctor-Patient Conversation, Back Pain, Orthopedics. This episode is part of our playlists, Real-Life Conversations and Medical English Conversations.
At FluentEars, our goal is simple: to help you speak English naturally in real-life situations.
Remember, fluency is not about using difficult words. It is about using simple English with confidence and clarity.
Follow our fluency method. Listen carefully. Repeat confidently. Note down the vocabulary and expressions from the subtitles. Use them in your daily life.
Because fluency is not built by watching. It is built by speaking again and again.
If you practice consistently, even 10 to 15 minutes a day, you will start noticing real improvement in your speaking.
Now, your turn. Have you ever experienced back pain? What caused it? Write your answer in the comments.
Practice with us daily. We also post MCQs in the community section to help you revise and improve.
To continue your learning, watch the previous episode, 22B, and explore the full playlist.
If you found this episode helpful, you can support us through YouTube Super Thanks.
Your support helps us create more practical and high-quality learning content for you.
Keep practicing, stay consistent, and remember,
confidence comes from usage, not perfection. We'll see you in the next episode.